This video will describe our technique for performing an arthroscopic remplissage utilizing a knotless suture staple technique for Hill-Sachs defects in the beach chair position. The patient is placed in the beach chair position and diagnostic arthroscopy is performed. This demonstrates a diminutive anterior labrum. Looking posteriorly, a large and relatively medial Hill-Sachs lesion can be seen. This technique uses two 2.3 mm Iconics knotless all suture anchors from Stryker. A sharp T-handled punch is used to aid in puncturing the infraspinatus tendon and capsule during anchor insertion. The repair strand from one anchor will be shuttled through the knotless mechanism of the other anchor, creating a suture staple that will compress the infraspinatus tendon into the Hill-Sachs defect. After diagnostic arthroscopy, two switching sticks are used to switch the camera to the anterior portal to allow placement of the anchors posteriorly. We place the anchors for the remplissage prior to repairing the labrum because once the labrum is repaired, the humeral head sits more posteriorly and directly abuts the posterior capsule, making anchor insertion more difficult. A cannula is inserted into the posterior portal. The cannula is inserted all the way into the joint and then withdrawn until it is outside the infraspinatus tendon but still deep to the deltoid. The anchor drill guide with the sharp T-handle punch is used to pierce through the infraspinatus tendon and capsule in line with the Hill-Sachs defect. The T-handled punch is sharper than the standard obturator used with the Iconics and facilitates piercing the capsular tissue. The anchor is then drilled and malleted into place. Prior to placing the second anchor, the orange cannula is removed and reinserted with the sutures from the anchor outside of it. This prevents the sutures from the two anchors from becoming tangled during insertion of the subsequent anchor. The drill guide and obturator again used to penetrate the infraspinatus tendon, this time more inferiorly. The tissue between these two anchors will ultimately be compressed into the Hill-Sachs defect at the end of the case. Now that both suture anchors have been placed through distinct parts of the infraspinatus, the posterior cannula can be removed and the sutures snapped for later tightening. After the remplissage anchors are placed, attention is directed to the labral repair. The labrum is elevated, anchors are placed, sutures are passed through the capsule and the labrum with a lasso. Knots are then tied away from the glenoid. Switching sticks are then used to place the camera back through the high anterior portal to finish the remplissage procedure. The repair suture from one anchor is then passed through the looped shuttle suture from the other anchor. This shuttles the repair strand through the knotless mechanism of the opposing anchor. This process is then repeated. No posterior cannula is needed for this step since both sutures were placed through the same defect in the deltoid. The repair strands can then be tensioned to compress the infraspinatus tendon into the Hill-Sachs defect. The residual repair stitches are then cut flush. This is after completion of the Bankart remplissage. The Hill-Sachs defect is no longer visible posteriorly, and the humeral head is nicely centered on the glenoid.